We've done this before. In season 1 of Debates Arena, we focus on sports, a topic that brings together many Ghanaian youth. But as we draw closer to the December general elections, the future of Ghana hangs in the balance. And it's been said that the voices that would matter the most would be the young, vibrant, and passionate Ghanaians who would cast their votes. So this season of Debates Arena, we are bringing together courageous and informed youth to debate the critical issues that will define Ghana's next chapter. Now, our debaters aren't just arguing for points. They are fighting for their affiliated parties, and they will try to tell you why you should vote for those respective parties. This season, it's more than just a debate. It's a call to action. It's a reminder that you have the power to determine Ghana's next leader and shape its destiny. Join the conversation, engage with the issues, and make your voice heard on social with the hashtag DebatesArenaPE.
Hi, my name is Sarfo-Kantanka, and I represent the Movement for Change. We want to make Allah president of Ghana, to restructure our economy, to change everything that is not going well in our statecraft, and then, to be able to move Ghana beyond whatever mess we find ourselves now. Hopefully, Ghana will rise again. Thank you.
Right. I am Abilolo Jr., the president of Rotational Nurses and Midwifery Association, and I am a public health nurse. Actually, I'm an unemployed public health nurse.
Oh, wow.
Yeah.
Allah will employ you.
All right, let's hope to see that.
Yeah.
Successive governments have failed to adequately address Ghana's rural healthcare infrastructure, leaving it severely underdeveloped. Do you agree or disagree?
It is a great privilege to speak on a topic that affects numerous Ghanaians at the rural areas. Well, there's a commendable progress in our healthcare development in the rural areas, with government introducing a lot of policies. Successive governments introducing different policies to seek to improve the welfare of people in the communities. But if you really analyze some of these policies, they've not served to the great impact that they are expected of. We, as a public health nurse, a nurse who work in the community, there are some challenges that I can tell you. First to speak on is the infrastructures. We know of this current government policy, that's Agenda 111, trying to build hospitals in the various districts across the countries. But when you go to those areas, you see the policy can be there, but there are a lot of things that have to be done before bringing up the policies. Accessibility to the facility is one problem. If we talk about infrastructure, we are talking about good road network, good water systems in the community. Some facilities, as I speak, have been completed, health facilities, but actually in the bush. So what is the essence of building that facility? To talk about low staffs, there are some facilities in Ghana here that serving a community with only 2 nurses or 3 nurses. So low staffs. And what happens is that it's not that we don't have staffs. As I'm speaking, I'm unemployed. I've not been employed yet. When it's time to employ me, and you send me to go to Achimbieni in a very deprived community, what will motivate me to go there? Nothing. Because where I'm going, there is no network there, there is no good water, and that facility where I'm going, the moment I enter there, I don't have any chance of living again. So low staff morale. Nurses at the deprived communities are not getting any incentives. These are some of the things we should be looking at. Someone who is in the community, in the village chiefs, let me call it a village chiefs, is taking the same salary with someone who is running a 12-hour shift or a 6-hour shift in the city. But the person in the village, at every point in time, there is no shift. You are only 2 in that facility. But when you are there, even at night, someone can knock on the door and say, I'm not well, you have to treat that person. You get me right? But someone who is in the city, or let's say a better developed community, is on shift, goes to work in the morning at 8 and close at 2 p.m. So if you are posting a nurse to such deprived area, the nurse wouldn't like to go, because if the person assesses the situation in which he's going to live there, bad roads, poor water system, water supply is very poor, The network is not good in those communities. So those are some of the things we should also be focusing on, not just building the facilities, but what should we put in place? In the recent years, government has introduced some policies that when you are in the deprived areas, you gain promotion after some years you've worked, but people are still not taking it. Why? You are promoting me, let's say, I am a community health nurse. After 2 years of working, you said you are promoting me to a senior community health nurse, which has maybe a salary difference of 100 cedis or 200 cedis. Why should I go and stay in the community and work for 2 years to have an increment of 200? I mean, something very little, where I can be in the city and gain access to other avenues. I can do business. I can do other things in the this and that. I will gain more income and have close access to my family and my friends. So when we look at the challenges, like I said, infrastructure is a problem. Two, the staffing. There are low staffs in the rural areas. And to talk about the low supply of medical commodities. If you go to some villages, they don't get the medicines or the drugs to serve to the people. The nurses request, the health workers request, but it doesn't come. So some of them, I've worked in some CHIPS compounds that the nurses have to take their own monies to go and buy drug to make sure it's available. Because if they come to the clinic or the health center and you tell them, oh, you do the malaria test, you've seen that it's malaria, and you tell them that there is no medicine, so let me write the prescription for you, go to the next town and go and buy it. When the person leaves the hospital, the person will not go. Considering the distance to the nearest health center, I mean, if you are referring, the person would have resort to what? A traditional medicine, which is not improving the health system. So some people have to, develop strategies to use their own monies to buy commodities, to be selling to health workers, which in a way is not good. Governments have to ensure that there is equity, especially in the distribution of staffs and medical commodities to nurses in the rural areas.
Well, thank you. So we keep saying that a healthy nation is a wealthy nation. But let me put things in a certain perspective. Ghana's healthcare delivery, healthcare system, a very complex one. And the complexity is seen in, how the interplays work between the different stakeholders in the healthcare delivery, and then even the very people the health workers are supposed to be serving. So you see there's a whole world of, a complexity there that I'll try and go in. But I want to make the point that if the country is suffering from an economic mismanagement, if the economy of the country, the macroeconomic indicators are not pointing in the right direction, definitely you're going to have the correspondent effect on healthcare delivery and the healthcare system. So there's this proportionate, relationship between a health system, like all other factors of growth or development in a country, to the economy, the bigger economy. So that preamble laid, I can now go into the main issues. You said you are unemployed. Why are you unemployed? Because government cannot afford to add every student who graduates to the payroll. You get it? Because, again, of the economy. The economy is crashed. So they can't add on a lot of weight. Already, we are spending over 70% of our GDP on emoluments, paying salaries and benefits. So clearly, then you have a problem with staffing when it comes to healthcare. And just like other systems, I'm going to limit to health because this is a health discourse. Now, back to our complex health system. We need to strengthen every level of healthcare delivery. So Ghana has 5 levels of healthcare delivery. We are looking at the health posts, the primary care facilities like the CHIPS compounds, CHIPS zones and all that. Then from there you have the health centers and clinics. And then from health centers and clinics, you have the district facilities, district hospitals, and then you have the regional level, and then the tertiary like Kolebu, Konfanochi, and all that. Now, like the name goes, it's healthcare delivery. So you are supposed to deliver a service to people. And then people have different needs that make them come to different facilities. So for instance, people in Accra would not get up and just go to Kolebu when they have headache. Maybe there's a clinic by them, a primary care facility by them, they will go there rather than go all the way to Kolebu or UGMC. So there are referral systems at the tertiary level. The challenge, as I've seen so far, is that, like I stated, the economic management has not been that effective enough to deliver the level of reliefs we need in our health system. So health insurance has been a very good addition to our contribution to health system financing. Unfortunately, it's struggling from the same economic challenges. Everything comes back to the economy that has been mismanaged. Now, we are supposed to send supplies to medical equipment and all that. They are not coming. They are not forthcoming. Like you mentioned, you go to the primary care units like CHIPS. Sometimes you see the deplorable state of the facility our nurses, community health nurses, reside in. And I was glad you said this, you've worked in the CHIPS, so then you know there is no off time. You are working 24/7. Once the community realizes our nurse lives here, every issue, somebody, snake bite, malaria, headache, everything, they'll come to the nurse. That is the burden at the primary care units. That is the burden you have at the community and rural levels. Now, the question I would want everybody to ponder over is, what has been government's contribution to strengthening our health systems from the primary all the way to the tertiary, where you have no bed syndrome and all that? I had a friend who called me almost a year now. Sarfo, do you know somebody who can help me get a bed for my father at Rage Hospital? That's a regional hospital. The dad was not well. I managed to make a few calls, then they got a bed for the father. But eventually, I think the man passed on because the travel time to the hospital and all, and the time they were bouncing them. They got to the hospital, they said there's no bed and all that. So clearly, different facilities have different problems. Why is it that government is unable to resource each of these facilities? Why is it that government is unable to, do as much as the development partners are doing? And so back to my question, what has been government's contribution to our health system strengthening? What would have been our fate if we didn't have agencies like COICA, JICA, the World Bank, European Union, all these international agencies? If they were not building the CHIPS compounds and all that, then you have politics as usual. And that is why I keep stressing on how crucial it is for Ghanaians to accept the great transformational plan Hon Kyerematen is preaching. Because in there, you have a master strategy to strengthen every single component of our health system. Every single one, from CHIPS to health centers, to staffing, to equipment, to, all kinds of stakeholders who are well catered for in the great transformational plan. One other addition Hon Kyerematen is proposing is, let's have what we call a general practitioner. So for every community or a zone, we zone the country, like it's done in Cuba and other developed countries. If you live in a certain range or zone, then there's a doctor assigned to that zone or that range. This is unprecedented. This is what Ghana needs now, because not everybody is like me who has doctors around me that anything I can pick a phone and call a doctor and I'm sorted. There are people who have real challenges, but they can't access healthcare in Ghana. So access is a problem. Now, whereas we try to bridge the gap in terms of access with our introduction of primary care facilities like CHIPS zones and all that, you realize the health facilities themselves are unable to create demand. What do I call demand? They are supposed to deliver healthcare. Now, healthcare is in varied ways. It's their duplicity of, needs that people come to the hospital with. So if you need endoscopy, I don't think you go to a CHIPS zone for endoscopy. You go to a regional or a tertiary facility, right? So at the community level, where there's direct interface with these community health workers, are they creating the demand for the service by resourcing the facilities? And the answer is no. We've left all these things to, the international agencies, the partners to do. Ghana Health Service is yet to be that economically strong enough to provide the needs of our complex health system. So clearly, the buck stops in leadership, as the US President Truman says. And I think it is very important we bring Alan Kyerematen and the movement for change to bring the necessary reforms in our economy. The macro economy must be fixed so that we don't. Can you believe that for a country with a GDP around 76 billion, we are spending just 6% on health infrastructure? That's where we are. So we are not spending enough on health. Meanwhile, we say a healthy nation is a wealthy nation. But we are not spending our resources at the most important sectors. And that's a problem. I believe it's about time we all began to make these issues matter to us. It should be our heartbeat. That we can't continue with the usual politics where the duopoly, they pay lip service to our dire needs. But we must begin to vet their proposals. So you go about building Agenda 111 hospitals. These are not primary care facilities. The poor people will still struggle to access your Agenda 111 facilities because they are in the villages, the remote areas. Transport to even go to. Why did John Kuma die? Because they couldn't rush him to the hospital in time. I mean, around the time the complications came, they were not looking for the safest place, So how come from Ejiso all the way to Suhum, they didn't find any hospital in between? Because the hospitals, the facilities in between do not provide the services he needed. You understand? So it's very important we resource every single facility in the complex health system to be able to deliver the service our people need. And on that, look, I'll vote for Alan Kyerematen any day because he has the most practical proposals to turn the fortunes of this country. Thank you.
So when you were speaking, I took notice of some few things. In the health system, in the levels, we have the primary, secondary, and the tertiary. What the primary objectives are cannot be the same as the secondary and then the tertiary. And yes, you stated that in your policy, the movement for change is to equip all those levels with the needed resources. Do I get you right? Is that what you mean?
Yeah.
Yes. Okay. So what I want to understand is that this is a policy from a political leader. And this is what we've been seeing over the years. There have not been any political leader that hasn't promised enough of this. And personally, I think the challenge we are having as a country is that we are taking a lot into politics. Whilst health is not a privilege, but then a right. According to WHO, no matter your race, your creed, color, even your political affiliation shouldn't prevent you from enjoying some of these benefits.
Yeah.
So I think regardless of whoever becomes president, our fight should just be on the things we need at our various levels rather than focusing it on who becomes the president to make these things happen. Because as we are here now, just as you stated, Honorable John Kumar died because he couldn't access a nearby, facility. Who knows, before that time, it could be me or you advocating for this change. So this thing should be policies that should be laid down, and there should be agencies that make sure, there are agencies. The Ministry of Health is responsible, Ghana Health Service is also responsible. We should rather be on those people to make the right things. You said that the economy is not good, everything lies on the economy, but at the latter end, you made something which says that, you said that this one is only 6% of our GDP that has been focused on health, which means there's not much priority given, which means there's not much priority given to the health system. So this should be things we should be demanding as Ghanaians, but not seeking to get resolve from political parties. This is what I have for you. Why don't we fight for these things now? Since the vulnerable people in the villages who cannot afford, who have bad road networks, it's not only about supplying to them, but giving them good roads, good water, the staffs, employing the staffs. Ghana is capable of employing staffs. Me, personally, I see that our unemployment is not because the country cannot provide. It's because the right policies have not been in place. Why do I say this? Why do I say this? As we speak, thousands, 10,000s of recruitment into the various nursing schools have been done, same as the medical school, the laboratory technician, all aspects of health field. Yes, because we need those staffs. But what happened? Policies have not been put in place. And this is what we should be fighting for, not who should come and do it as ordinary Ghanaians. What do you have to say about that?
Of course, I have a lot to say about that. I disagree with you that you want to blame policies, but not the people who execute policies. Policies do not by themselves translate into results. You need actors, human beings, politicians, presidents, who appoint the head of Ghana Health Service, who appoints the Minister for Health, who appoints, they are at every level of our healthcare delivery, you find leadership there. Sure. And so it becomes a bit disingenuous for you to want to conveniently blame policies and shy away from addressing the perpetrators of our impoverishment, the mess we find ourselves. You said a policy can make you employed. Well, to the extent that that policy can give the government a very good balance sheet so that they can add on to their payroll more employees, then I beg to differ. I beg to differ. Government must fix the economy before they can get. So for instance, we run a deficit financing regime where even like I said, the money to pay our salaries for people have worked. GRA takes revenue and all that. But the money to pay people's salaries, we have to borrow to come and pay them. That's essentially what deficit financing is. So definitely you won't have enough fiscal space to procure all the necessary medication, all the necessary equipment to build the infrastructure, the roads and all these things you talked about. The buck stops with leadership. I don't see how we can excuse government. We are here because of the decisions and indecisions of our leaders. Really. I'll give you an example, and that goes to President Akufo-Addo's credit. He came and the ambulances we had in the country was nothing to talk home about. He just said, okay, every constituency must get an ambulance by a leader. Ghana has ambulances all over. Of course, there are structural issues there too. Fueling, you call them, they're even getting them to attend to the emergencies and all that. It's a problem. That's another conversation altogether. But I'm trying to draw your mind to the fact that with a good leader like Alan Kyerematen, and I don't think people have paid attention to Alan's contributions globally enough. Throughout his life, he's served at the global level before even joining politics. So he's not someone you can say was made from our NPP NDC politics. No. Alan in 92 started Empretec. Emprotech now became a UN project that he ran across Africa called Enterprise Africa. Through that Enterprise Africa, he gained recognition by Nelson Mandela, by key people who saw that this man is different. He's on a transformational path for countries he touched. So if this man gets up and says, hey, we've been doing things the wrong way with the MPP, NDC, toxic, adversarial, it's like once MPP is in power, NDC becomes enemies. They can't contribute anything to what MPP is doing. You should have these toxic debates, you know, to the extent someone can say you have polluted more water than us. You know, these are not progressive enough. Now this man has come out of this duopoly and he's saying, guys, let's do things differently. There's a transformational plan. Let's be united around a national development plan. And he's brought a great transformational plan, which gives the path, the very solutions you need at every point to transform things. I would want you to look at his policy proposals like the general practitioner scheme and pitch it against all the others and tell me his is bad. You can't. So let's look at policies and the technical competence the person brings on board rather than, you know, I'm very careful in using some words. There's a word called hegemony. Hegemony is when there's a dominant group all the time, so everybody's attention is on the dominant group, MPP, ND, so they can't even begin to appreciate the role a new movement can play in our forward-going, our development. That is our problem. And I think all of us young people should be serious about this call and then assess them based on their competence level. And Alan will be our next leader. Trust me.
Well, I picked a point from you that says Ghana needs a more visionary leader. Mm-hmm. Yes, I think that is what we need as a country. Yeah. And we hope to see that. Mm. But my point is that, yes, you made mention, I know this is not all the policies about health.
A lot.
There are a lot, like you can say, yes. But when you look at the issues in the rural areas, I mean, factors that affect their health, it is not only about the infrastructure they have there, but it relates to the road network, the water they drink.
That's
and you know, yes, I mean, even the staffing system and all that. Recently, there have been rising these kidney diseases, and most people in the rural areas are dying of kidney disease without even diagnosing it. Do you get it? Because the accessibility is not there.
Have you bothered to look at what caused the surge in kidney infections?
You know,
it's around these galamsey sites. Yes, I'm telling you, and I know it for a fact.
There are a lot into that.
So if they are polluting our water with mercury, and we have government appointees complicit in this perverse deed, then we have a problem.
See,
that's why we have to set aside this duopoly and begin to look at things that will work for all Ghanaians. Which leader serves our common interest? That is it. Now, go to the rural areas again. At the community health planning services level, you have, it's not like just the nurse doing their work. No. There's a community health management team, community health teams, which comprises of a rep from the district assembly, a rep from health insurance, a rep from the chiefs and elders. Yes, and then the natives, there's opinion leaders. So you see, if the DC sits on that board or the committee, if their district common fund is not coming, how are they supposed to pay for some of the expenses around health delivery in the community?
Well,
you get it.
Yes.
So you see, the buck still stops with leadership. Government must pay the common fund, district assembly common fund. so that they will get money for development needs in the district and the communities. But it's not coming because the economy is broke. The country is broke. That's why we are here. That's why we need to change this regime. These people focused on amassing wealth. They don't care. Just drive out of Accra and you'll see poor people all over, even in Accra. Sometimes I go to some of these ghettos just to interact with the guys. It's sad. On the Lagos Avenue, I stop. Sometimes I want to interact with these sex workers. If you hear why they are doing it, you will be sad. We are not building a country.
I don't want to accept the fact that these challenges we are facing in the rural areas is because the country is broke. So, I don't want to accept that fact. You understand? If we say the country is broke, the economy is not doing well, but we have other sectors running well.
Like
you understand?
What? There's no sector in Ghana that is running well now.
Okay.
It's been ad hoc measures all over. I can tell you for a fact. And if I don't see how a country owing so much, you can say we are not broke. If we are not broke, why are we owing so much?
When we look at our rural areas as we speak today, and we look at other agencies or sectors, I could say that the economy isn't the factor why the rural, areas are not developing in terms of health. What are we seeing? Just in the recent weeks, the Youth Employment Agency has recruited some number of people that have been trained in different fields. Skills. Some are hairdressers, some are this, some are... Yes, that's a very good initiative. So if we are saying there is no, the economy is not good, it's not in a good standing to support rural areas where staffs are not there, medical supplies don't go there, then it's not being fair. So it's all about priorities. It's not always about good leaders. We can have a good leader who have nice policies, but implementation of those policies would be difficult because the system, and when you want to build a system, it's going to take a whole lot. So I agree with you that Ghana needs a visionary leader, but when that visionary leader comes, I would make mention of this. The current president, His Excellency Nana Akufo-Addo, yes. When he was in opposition, he was a very visionary person as well. Great, he did a marvelous work being the president, but there is more work to be done. I'm not here to pinpoint what he has done and what he hasn't done. So that could be the same in the position of the movement for change. We as youth or health leaders, health workers coming up, want to see lasting changes that are not based on politics, but about policies. And those things cannot be changed. When these Agenda 1 hospitals are built, some of them will be left there. Maybe, should it be that there is change of government this coming December, the successive government will not be ready to continue that project because at the long end, it will be termed as we started it. The NPP started it, or His Excellency Nanado started it. No, this shouldn't be things that are ongoing. A lot of projects have been abandoned just because of government policies. We have indifference, but those projects should be continued by the successive government to bring development rather than focusing on policies that brings credit to an individual. That's what I wanted to bring to your notice.
Well, I disagree with you entirely. Because like you concluded, everything Alan is saying is not for Alan. It doesn't bring credit. If it's bringing credit to him, then it's the legacies he would have left as the transformational leader, like Deng Xiaoping and all these big guys for China and other developed countries. But the fact remains that we are unable to provide for our complex health system because our economy is not doing well. And so we are at the mercy of development partners who, like I mentioned, JICA, COICA, all these agencies, they are the ones, doing so much at the rural areas and, primary care facilities. And then for an unemployed nurse, I want to assure you that should Alan come, if you vote for Alan, he's going to set up 100,000 booths to provide what we call early detection. So for diseases like hypertension and all these slow killers, I'll call it. We are going to set up 100,000 booths that will employ young people to run them.
With Alan inheriting an economy that is not in a good shape. It's crashed. How is that possible?
It's a very intelligent question. The country is broke.
Alan,
I'm coming to answer. Don't worry, I'm answering.
You referred to the economy as crashed, so I'm just using that to...
I'm saying you've asked a very intelligent question. Can I answer?
Sure.
Yeah. The country is broke. It's true. Now, Alan is making all the promises. Now, I'll give you an example of something Alan did without 1 cedi from the broke government. Now, we have 6 giant automobile industry players, companies, assembling vehicles in Ghana. He did that with the power of policy. Okay. Just by a simple policy, he drafts a policy that Ghana is going to do this, that. You attract investors. You attract foreign direct investments into your country.
So with this, you agree with me that
private sector.
It's not always about the leader, but it's the policies that should be laid down that brings this change.
Kofi, who drafted the policy?
And you said...
Who drafted the policy?
You see,
is it not the leader?
It is the leader.
Who is going to execute the policy?
It's the leader.
So, how do you take leaders off the equation?
Without these policies, there will be no result.
Somebody must sit and draft it. We've been in a country for how many years now? It took Kyerematen to draft a policy that we are going to start an automobile industry in Ghana. And you had all these giant car manufacturing agencies coming in.
When we focus on the healthcare system, there are policies. There are policies that are not being enforced.
It comes back to leadership.
Yes.
So that's why you need Alan to come and execute all these policies.
We don't need to have someone. A different person. No. What I'm trying to say is that
you don't think leadership must change for things to work.
Leadership change for things to work. Leadership is like a train. It has to move to make progress.
I saw you trying to, you are a bit in despair because you feel the leaders have not done. It's been politics as usual. They've not done enough.
Yes.
And you try to compare Akufo-Addo to Alan. But look,
I'm not comparing.
Alan cannot be responsible for Akufo-Addo's mess. No. Akufo-Addo is a person.
Yes.
He has his strengths and weaknesses. Alan has his. You understand?
Actually, I would say I love the visions
that can be said of all other presidential aspirants. Alan has distinguished himself. I pray we judge him, we assess him based on his own merits and what he's done, rather than, comparing him to people who have not really done what he has done before.
I want to say is that we should look at the policies these individuals are bringing. Our choice should be based on the policies.
Yes, and on policies, then everyone will go for Alan.
And based on the discussion we are having now on the health structure, in the rural areas, it should be based on the policies which are already there. There is nothing new to do. I'm not sure if these various political leaders, when they come, they are going to break down everything and start new. But they are going to build on...
Let me tell you something new. My project at the World Bank contributed to our healthcare. Just by documentation. You realize you people at the primary health, you say you are working, but you don't document. You say you went for child welfare clinic. You attend. You don't document.
You are wrong. You are wrong on that. If you
my
say that
project created the dashboard they are using now. You're saying I'm wrong.
We document.
I know what we are talking about.
Documentation is one key process. But what I have to say is that
documentation was a major problem in Ghana health service delivery. I'm telling you for a fact, and that's on authority.
No. I would say that's wrong.
On what basis do you say it's wrong?
Documentation was what they say was a problem. That cannot be a problem.
Well, I'm telling you, it was a problem. Maternal and child health program MCHIP?
Yes.
Yeah, we were running it. I was a technical advisor.
Well, we should be embracing change. So I would say it was a problem. Every solutions we have today were
So
problem
you
before.
concede it was a problem?
It was.
Yes.
It was. It could be, but now it is not a problem. It is something, a result we have gotten. So we should focus on.
It's not a problem because it's been resolved. We identified it and worked on it. Now there's a dashboard, the District Health Information System, DIMS. You know it?
Yes, I know this.
Yes. So if I'm saying it, it's not like I'm speaking out of.
I didn't get you. I thought you said it's a problem. I mean, if it was, that is fine. But that's not a problem
so
now.
That's why you need a leader to come.
The problems we have now. Let's talk about the problems we have now in our rural communities. That is, they don't have the infrastructure.
How will they have it? You need a leader to fix the economy before he can get the good balance sheet to buy all the supplies you need at that level. My brother, join this team, join the movement. It's for young people. Let's reset our country. What these guys are doing, we are not building a country.
We all want to build a country.
Yes. But so I'll give you a copy of the Great Transformation Plan. You should read and then, you know.
I will do that.
Yeah. Let's build that.
One thing we have to focus on is the development of our rural areas. When we are talking about the infrastructures in the rural areas, the poor staffing, the amenities, the supplies, those are things, we can't say government has failed. There have been some commendable, efforts by government over the years. Both the NDC and the NPP have been doing so well in terms of health, but there are some bridges that they have to, close. There are some little challenges, like I said, nurses or even, health workers, being the PAs, the midwives, refuse posting to those areas because of the challenges they face. So these should be things that the ministry, the Ghana Health Service, and even, the government in all should focus on and bring those changes. You see, the documentation was a problem, but now it's not a problem. That is what we want to look at, that before in the rural areas, assessing the healthcare needs were a problem, but now there are no more problems on that. So I would not say government has failed. Well, they've done great, but there is more to do. We have to actually build on the systems that are there and make sure things work in the right way. And I think as a country, we will be great on that.
It's in the crack. Like you're saying government, there's nothing more to be done.
I didn't say, I said,
you're saying there's no reason to change government.
Oh, I am not saying.
Is there a reason for us to change government?
Well, you use the word change.
Yes.
And when you are talking about change, it's for it to progress. So
there's a reason.
There is a reason to change government.
So thank you for endorsing.